The Africa Centers for Disease Control and Prevention has asked for $18 million in urgent funding to support trials of experimental Ebola treatments in the Democratic Republic of Congo. Africa's pioneer health agency, the CDC, has warned that any delay, even by days, could jeopardize efforts to contain the outbreak. Clinical trials for potential therapies to immunize against the virus are expected to start this week itself in Bunia, Ituri province, where the first case of the new Bundibugyo strain was confirmed. The total number of individuals affected by this strain stands at 1,295, with the death toll at 362. Dr. Jean Kaseya, Director General of the Africa CDC, stressed the urgency of the matter, saying that the CDC already has the science but now needs funding to use it. He warned that if clinical trials do not start this week due to lack of funds, more lives will be lost. The therapy program includes oral drugs, obeldesivir to prevent infections, and remdesivir and MAB biopharmaceuticals antibody to reduce mortality among infected patients. It also aims to accelerate the development and manufacturing of next-generation Bundibugyo specific vaccines. While vaccine-related studies are largely funded, therapeutic trials remain critically underfunded. The Africa CDC is urgently seeking funding to start clinical trials, calling on governments, development banks, and philanthropic organizations to cover a $16 million shortfall. And this is within days in an effort to contain the spread of Ebola. For more on this story, WION's Louisa Olani has sent us more details with this report from Lagos, Nigeria.
Africa CDC is urgently appealing for $18 million to kick off critical drug trials against the Ebola outbreak in the DRC, as there are shortfalls in the initial targets for experimental therapeutics. This comes as the Bundibugyo strain outbreak continues in DRC and has spilled into Uganda, with hundreds of cases reported. The broader WHO Africa CDC response plan requires hundreds of millions of dollars, but funding gap remain. Health officials warn that without rapid support, containment efforts could be delayed. From Lagos, Nigeria, Louisa Olani, WION World is One.